of health behaviors and decision making. So I ended up working in tobacco control and tobacco disparities research, and it's really a perfect health issue in which to incorporate concepts of place. A lot of tobacco control policies are made at the local level, and when we evaluate them, sometimes there's differences in how they're implemented and their effects when it comes to geography. So that's what I'll do today, highlight some of the early results of New York City's initiative to decrease tobacco retailer density. I don't think this thing works. There we go. So often when I give talks to non-public health audiences, and sometimes even public health audiences that don't necessarily work in substance use, I have to remind them that tobacco use is still a major issue in the US and worldwide, certainly. The national smoking rate is about 14%, which is a historic low, but it's 14%. That's over 30 million people in the US who are smoking. And that's just cigarettes. We know there are many other tobacco products that exist. But this 14% really masks a lot of the inequities and disparities that persist. So just a couple of examples highlighted here: individuals with lower socioeconomic status, LGBT individuals, people with mental health, mental illnesses, or serious psychological distress. So the list goes on and on. So from my perspective, tobacco use is one of the most pressing social justice issues of our time. We've done a lot to decrease the overall smoking rates, but all of the policy initiatives that we've done have done extremely little to close these gaps. So I don't want to abandon this fight until we both close these gaps and until we reduce that 14% even lower. It's important to note that cigarette smoking is still the leading cause of disease, disability, and death in the US. So that's my soapbox. Now, a lot of the policies that we've implemented so far have been pretty effective generally. Increasing taxes, smoke-free air laws, educational campaigns, access to cessation treatments. They are effective, but again, they have not closed these disparities gaps. So there's been increased attention now focused on environmental level interventions that target the retail environment, like tobacco retailer density. We know this is true across the US, especially in urban areas, that tobacco retailer density is disproportionately high in places that have a higher proportion of Black or Hispanic Latinx residents, places with lower income levels. And this is true across various settings. So we believe that by intervening on this environmental level determinant, that we can alleviate some of these disparities, perhaps better than anything we've been able to do to date. But this is a very novel strategy, and there's very limited real world evaluations. There's some simulation and modeling studies, but the ecological validity of those, how true they are in real world settings when the policies are actually rolling out, is a separate question. So that's something that I set out to answer. New York City is no exception to this rule. Here we have an oversaturation of tobacco retailers, the highest by far out of any major city in the US. And we see the same relationships with neighborhood characteristics that are associated with higher density. So just a couple of pictures from the field, kind of highlighting how saturated New York City is with tobacco advertising, especially in certain neighborhoods. So we were pretty excited when back in 2017, New York City passed this very progressive suite of tobacco control policies. And three of the components of this policy were particularly exciting to me because they dealt with the retail environment. First, there would be a new e-cigarette retail license created. So before 2017, any retailer could sell e-cigarettes if they wanted to. So now there's a license required. Two in particular deal much more directly with the retail environment and retailer density. So the first was a ban on tobacco sales in pharmacies. These are allegedly centers of health and wellness, so they should not be selling the deadliest consumer product that's ever existed in history. So there was a ban on those that was immediate. And then there was a more gradual or a policy that intended to more gradually reduce the number of tobacco retail licenses over time. So in today's presentation, I'd like to highlight three small studies that I did to try to comprehensively evaluate these new policy initiatives. First, the pharmacy ban. Second, that more gradual density reduction strategy, which placed a cap on the number of tobacco retailers allowed. And then finally, to really assess the equity of these policies, we need to know how they're being implemented on the ground, how they're being enforced, and some of the mechanisms of action. So let's start with the pharmacy ban. So this was an immediate policy change. So literally overnight, by January 1st, 2019, every single pharmacy in the city, both chain and independently owned, needed to stop selling tobacco products. This is very exciting from a data analysis perspective, because you can simulate this perfectly, essentially. If one day pharmacies are allowed to sell tobacco and the next they're removed as retailers, you can simulate this pretty cleanly and accurately. So together with Diana Hernandez, a colleague in SMS, we evaluated this policy. So we wanted to know, what is the impact of this tobacco ban in pharmacies on retailer density? So when you take out those retailers, by how much does retailer density decrease, and are there differences by neighborhood? And I'm going to use the term neighborhood a lot in this presentation, and I want to talk about how I operationalize that. For this study, I used New York City's neighborhood tabulation areas. These are really appealing from a research and analytic perspective, because they're aggregations of census tracts. So the boundaries perfectly align with census tract boundaries, which allowed us to compute really precise demographic and socioeconomic measures. And they also approximately align with historic neighborhood boundaries. So there's an NTA for Chinatown and Williamsburg. I'm sure residents would disagree with the drawing of those boundaries, but analytically, it's very appealing to use. So to simulate the effect of this pharmacy ban, we first calculated retailer density before the ban, so including pharmacies. So in the map to the left, the orange dots are all of the pharmacies in the sample of tobacco retailers. And then we simply remove those as retailers, which is what happened on January 1st, 2019. And we recalculated retailer density after the ban. So this is just kind of a zoomed in example of how we did this in Staten Island. And this was retailer density per 1,000 residents. So I'm going to minimize this window for the people in the room. There we go. So our outcome measure for this study was percent density reduction. That's the policy impact. So when you remove pharmacies, by how much does density reduce in each neighborhood? And then we used Pearson correlations and linear regression to examine the bivariate association between the reduction in density after the ban and various demographic variables. So we found some spatial patterns, some evidence of clustering in terms of the policy's impact. So on this map, that darkest color, reddish brown, are neighborhoods in which density reduced between 10 and 25%. That's huge for a policy like this to reduce density by a quarter, by 25% is really unheard of. And you see that neighborhoods that achieved that level of impact were places like Upper West Side, Upper East Side, Midtown, some of the more suburban parts of the city. Places that experienced no change or virtually no change were places like Northern Manhattan, South Bronx, that's like Brownsville, Brooklyn, Jamaica, Queens. We also saw some not only spatial patterns, but statistical patterns in terms of neighborhood characteristics. So, let's use the top left graph as an example. The greater the number of percent white residents in a neighborhood, the greater the policy impact. So the greater the reduction in retailer density. So the blue lines in these graphs represent a positive relationship and the orange lines represent a negative relationship. So in neighborhoods with a higher percentage of non-Hispanic Black residents, the policy was much less likely to have an impact. But we saw probably the strongest relationships for more socioeconomic measures in neighborhoods that had a greater median household income. There was a greater reduction in density. And this has really everything to do with the spatial distribution of pharmacies. So if pharmacies are more likely to be located in certain neighborhoods, of course, by removing them as tobacco retailers, you're most likely to benefit those neighborhoods. So that's kind of the mechanisms through which we observe these effects. So this is a classic example of a policy that was implemented equally. Every single pharmacy across the whole city needs to stop selling tobacco, but its impacts were not equitable. Really, the greatest benefits of this policy, the greatest impact, were in neighborhoods that already had high levels of social or economic advantage. So I just read an article that said you're supposed to divide talks up into episodes. So that's episode 1 of the series. Are there any questions that I can answer now? Merlin.
If it takes too long, don't worry about it, but could you just very quickly go over the density metric, like how that's calculated?
Sure. The question was how I calculated the density metric. So it's the number, remember the unit of analysis are neighborhood tabulation areas. So like Washington Heights South, it would be the number of tobacco retailers per 1,000 residents. There's various ways to calculate density. You can do it more spatially, like the number of retailers per square mile. But I find that kind of a more standardized measure is per 1,000 residents or per 10,000 residents. Jennifer.
I'm wondering about the data source for the retail environment.
Mm-hmm. Thank you. I switched the order of these studies, and I'm describing that in the next one, but I should have. It comes from the city of New York, but I'll describe that in more detail. Thank you. Ron.
Do supermarkets sell cigarettes?
Yes, the question was, do supermarkets sell cigarettes? They do, not all obviously, but many do. There's really no limit, with the exception of pharmacies, there's no limitations on what types of retailers can sell tobacco. They just have to apply for a license from the city. I've gone into a couple of beauty stores that sell tobacco in New York City and souvenir shops, so. Gina.
I'm wondering if the retail facilities were sort of closed, but did sales of cigarettes actually pop up in other areas?
Great question, and it's a perfect transition into the next study. The question was, when you removed pharmacies from the sample, if demand was still high, might we see that other places started selling cigarettes or that sales were higher? And I think that might have been the case if not for the second component of this policy, which was a capping strategy that was implemented around the same time. It's like we didn't plan that, but that was a perfect transition. So we were a little bit more optimistic about this second component of the policy in terms of its equity impact. So this was it's a policy that was intended to have more gradual effects. Essentially, the city placed a cap on the number of licenses allowed in each community district. So we're not talking about neighborhood tabulation areas anymore. These are the city's 59 community districts, pretty broad administrative boundaries. But essentially the city said, we're not going to issue any new tobacco licenses in any of the community districts until the current number falls below 50%. So they wanted to cut the number in half. That's the ultimate goal. So no new licenses until the number falls below that 50% cap. And they created separate caps for traditional tobacco products like cigarettes, and also a separate one for e-cigarettes, but both at 50%. They want to half the number of retailers. And the way that this policy is implemented, or its mechanisms, is that it happens through natural attrition. So for the most part, no one's licenses are getting revoked like they were for pharmacies. It happens over time as businesses either decide not to sell tobacco anymore, some just voluntarily stop. Sometimes there's business closures, so the license will be lost that way. Occasionally there are revocations too, where a retailer is in violation of policies like selling to minors, or they don't have proper insurance, or they don't pay their licensing fees, a variety of reasons. But I think the reason why this policy actually had pretty high stakeholder support is because retailers who are in good standing with the city can continue renewing their tobacco licenses in perpetuity. And also there's kind of this grandfathering policy where even if a business changes ownership, it sells off to another business, that new business can take over the tobacco retail license. Sometimes, you know, if a bodega sells to like a yoga studio, that wouldn't happen. But if it's a similar kind of retailer, that license can be transferred. So again, high stakeholder support for these reasons, but also it makes it really difficult to simulate. We can't really do these simulation modeling studies for this policy because this has really never been done before. We don't know what the rate of attrition might be or what stores are more likely to give up their license. So this has to be a real world evaluation. The city estimates that 10 years after implementation, we could see up to a 40% reduction in the number of tobacco retailers, which is huge. So for this second study, we had a couple of main research questions. First, what is the impact of this capping policy on the number of tobacco retailers? So since the policy was implemented in 2018, how many licenses have been lost since then? Hi, Angela. I love hearing your beautiful voice, but would you mind muting yourself? Second, we wanted to know whether these declines in the number of licenses have occurred equally across community districts, and whether the policy has produced equitable results in terms of retailer density. Because as I mentioned in the beginning, New York City is no exception. There are certain neighborhoods and certain neighborhood characteristics that are associated with higher density. So is that more balanced now that retailers have started dropping off? Jennifer, to answer your question, New York City is pretty great at making many types of data publicly available, including the list of licensed tobacco retailers. So you can just go in and download the addresses of all the licensed tobacco retailers in the city. So we did this from 2015, a couple years before the policy, to present day, or as recent as we could get in 2020. So we also computed demographic characteristics of each community district. Again, these are those broader administrative boundaries. And we thought that zoning characteristics are important. There's certain community districts that are almost entirely commercial land and probably have a higher number of tobacco retailers, whereas others are much more residential. So we got that from the Department of City Planning. And our key measures were just the percent reduction in retail licenses. We wanted to know how many licenses dropped off, what percent reduction we saw. And I'd say our main outcome measure was progress toward that 50% cap. Because if the city set 50% as its goal, we want to measure how close we are to achieving that goal. Formula's there, but I think this graphic makes it a bit more clear. In this example, let's say this is a neighborhood or a community district, it would be about 50% of the way to that target cap. So it's the number of licenses lost since baseline divided by the number that they need to lose to reach that cap. It is what we call percent progress toward the cap. And then finally, we measured retailer density, again, because license loss is one thing, but to truly see if the retail environment is more balanced after the policy, you need to calculate density. So for this study, we mainly used descriptive statistics to see how many licenses were lost before the policy, because we suspected that there would be a decline, and then post-policy. And then we also ran some descriptives for progress toward cap. And then our data were non-normally distributed, so we used Spearman correlations to measure the bivariate associations between progress towards reaching that cap and various community characteristics. And then as one way to measure the equity of this policy, we first calculated the association between retailer density and community characteristics before the policy. We expected that they would kind of follow the historic patterns that we know exist. But then we recalculated them after the policy to see if there was any kind of attenuation or potentially even an exacerbation once the policy went into effect. So here's what we found. Between 2015 and 2020, there was a decline in the number of tobacco retail licenses. And this was a particularly sharp decline after 2018 when the policy went into effect. We do have to acknowledge that the pharmacy ban was implemented during this time. So a lot of this loss was because of that immediate removal of pharmacies. But even if you exclude pharmacies from the sample, we still see evidence of a sharper decline post 2018. Before the ban, before the density reduction strategy, the rate of license loss was about 10%, but after the policy, it dropped to 25%. For e-cigarettes, because remember, there's a separate capping policy for e-cigarettes, it was a much slower decline, only about 8% after the policy. So citywide, let's talk about the traditional tobacco licenses first. By 2020, this is just 2 years after the policy, the city is already about a third of the way toward that target cap of having tobacco retailers. But that's citywide. There's variation across community districts. It ranged from 0% in portions of Eastern Queens. I think Flushing might be one. The Flushing area is one example, but that saw no decline. So they didn't lose any tobacco licenses following this policy implementation. Whereas in places like the South Bronx, areas of the South Bronx, the decline was about 71%, or sorry, not the decline, but they're about 71% of the way there toward that target cap. When we look at e-cigarette license loss, we see it's happening much slower. Again, we see variation across the city. So there were many community districts that did not lose any e-cigarette retailers between 2018 and 2020, where places like Central Harlem and South Bronx are over 50% of the way there toward meeting that target cap. This is what these patterns look like geographically. So on this map, the darkest red color are neighborhoods that are between 38 and 70, it's a wide range, but are much closer toward reaching that cap. So we see evidence of spatial clustering in places like Northern Manhattan, the South Bronx, Brownsville, Brooklyn. And e-cigarette progress looks similar. You can see from the legend that progress is slower, but it's the same areas that are really seeing greater license loss. So I want you to take a mental image of these maps, and I'm going to bring back the pharmacy ban map. It's really it's a complete juxtaposition, really. It's the exact opposite neighborhoods that are now benefiting from this policy versus the pharmacy ban. And when we looked at statistical associations, a couple of variables stood out and were significant. So the greater the percentage of white residents, non-Hispanic white residents, the lower or the slower the progress towards that cap. In other words, the greater the percentage of non-white residents, the faster progress toward reaching that cap. A positive, although weak relationship with percent Hispanic residents, greater percentage of Hispanic residents, the greater the progress toward reaching that cap. And then this was sort of intuitive, but the more commercially zoned land a district had, the slower the progress toward reaching the cap. This makes total sense. If you think about places like Times Square and other really heavy business districts, they have so many tobacco retailers and thus more to lose to reach that cap. For e-cigarette progress, we only found one significant relationship. It was the percentage of white residents. So the greater the number of, or the greater the percentage of white residents, the slower the progress. And finally, as our kind of equity evaluation, we calculated the relationship between community characteristics and density levels before the policy went into effect and then after. So as one example, in 2015, the percentage of white residents was negatively associated with retailer density. So the greater the number of white residents, the lower tobacco retailer density. We found that this moved more towards the null. It's still not a positive relationship, but more towards the null. And we saw movement in that same direction for percent college educated and commercially zoned land. We found the opposite relationship for the other variables listed here. So for example, whereas the percentage of Black residents was positively associated with retailer density, although it's very close to null, but positive, it became negatively associated by 2020 after this policy went into effect. And we saw movement in the same direction for percent Hispanic residents, percentage under the poverty level, and residentially zoned land. So in terms of, when we look for policy equity, this is movement that we hope to see. All of these variables have historically been associated with high levels of tobacco retailer density, and we're seeing movement in a direction that we want to see. Very often tobacco control policies exacerbate disparities. This doesn't appear to be doing that. But in the next study, I'm going to get into some of the potential unintended consequences of this policy, or things that we need to be mindful of, because I term this progress toward the cap, but the mechanisms of this policy may bring to light more of the social and economic challenges of certain communities. So we'll get into that next, but episode 2 is now over. So I'll take questions. Ron.
I mean, obviously there's an assumption that the density of retailers has a direct relationship to the percentage of smokers.
Mm-hmm.
And have you done any analysis that shows these changes in density of retailers and impacts on prevalence of smoking?
Great question. The question was, first, is there a relationship between retailer density and the percentage of people who smoke? And have we evaluated what happens to the smoking rate when density decreases? Hopefully NIH thinks this is an important question, because I just resubmitted an R01 to study this exactly. We all assume that this is a great idea. Like, let's reduce tobacco retailer density. You're reducing exposure to marketing. You're making products a little less accessible, so it's kind of more challenging to obtain. We suspect that this would have a positive relationship with smoking cessation, but there's no empirical evidence of that yet. So I believe that's an important question, one that we don't know the answer to, but that hopefully we will. Marnie.
That made me think about alcohol and sort of alcohol density. But I'm just curious, how good is this city at actually enforcing who has licenses with actually selling? And they go around and check for that, or is it a little bit the Wild West?
Mm-hmm. The question was about policy enforcement. So how good is the city in enforcing licensing laws, making sure that there aren't illicit sales happening? Not so good, unfortunately, especially during COVID. The city had priorities, and I've been doing a lot of field data collection during COVID, and this is anecdotal, but I've seen a surge in the number of unlicensed sales. I was in retailers that I know didn't have a license on the books, and there were products being sold, sometimes from a drawer under the counter. I think especially during COVID, some retailers realized that no one's coming out to check on us, and maybe got a little bit more bold. We're
going to account for that in your natural experiment.
Yeah. So how do we account for that in some of our studies? It's difficult to, without actually going out and assessing it ourselves. So that's something that we wrote into the grant. We're visiting a sample of retailers that lost their license in the past year, and we're going to try to buy cigarettes there to try to capture what the prevalence of non-compliance is. Thank you. Azure.
I have a question about the licenses. So they are tied to the address?
The retail licenses are tied to the address, yes, not the business.
So, because I know in other states, sometimes alcohol licenses are tied to a business and you can sell them, then you don't have to be at the same address. So I wonder if that would affect real estate too. Like if you want to sell tobacco, you have to get a license, but there aren't any because it's capped. Would you then pay way extra for this one space because you're grandfathered in?
That's a great question. So yeah, as the number of tobacco retailers shrinks, they become more desirable essentially. So might there be a shift in movement of tobacco retailers or movement of businesses to certain locations to get those very desirable licenses? I don't know the answer to that, but I think that's an excellent point, an excellent question. Sorry, I don't have an answer, but I'm taking a mental note of that. Yeah, exactly. Stay tuned for season 2. Okay, so finally, we saw that pharmacy bans benefited one type of community, and capping policies seem to benefit another. But really, to evaluate equity, the equity of certain policies, you need to see what implementation looks like on the ground and what the mechanisms of action are. Specifically for this capping policy, we know that licenses are dropping off. But why? And which types of stores are losing their licenses? And in what types of neighborhoods are stores losing their licenses? So those were our questions. what types of retailers are more likely to drop out? Are they grocery stores? Are they beauty supply stores? Are they bodegas? And what are the reasons for license loss? Do they go out of business, or are there revocations? And finally, how do patterns of attrition differ by neighborhood characteristics? So again, this was a very small pilot study just in the borough of Manhattan. We just completed this study. So we identified every license that was lost in Manhattan since 2018, when the policy was implemented, up until 2020. And these are licenses that are completely lost. So not a business turnover, but they've completely dropped out of the sample entirely. And when you download that licensing list from the city, it doesn't tell you anything about store type. And in fact, some of the independently owned stores, it won't even say the store name, it'll say the business owner's name. So it's really hard to tell what type of store it is, but we utilize Google Street View imagery. It's historical imagery. So in major cities around the globe, imagery, Google Street View imagery is updated every year or every 2 years. So you can really zoom to any point in time in the past couple of years to see what that store looked like at that moment in time. So we use that imagery to categorize store type in the following categories: chain convenience store, like your 7-Elevens, independent convenience stores like bodegas and delis even, grocery stores, newsstands, and smoke shops or vape shops. So these were some of the example images that we used in our data coder training to kind of classify these different store types. And New York City also has a data set that not many other major cities have. It has a list of essentially reasons for license loss among businesses across the city. It's called license revocation, suspension, surrenders, and reinstatements. So we were able to merge the data set on tobacco retailers with the data set on reasons for license loss to better characterize why retailers were dropping out. And we grouped these reasons into two categories: non-punitive reasons for license loss and punitive. Non-punitive included expirations. So sometimes a tobacco retailer just didn't renew their license. They let it expire. Presumably they're no longer interested in selling tobacco, but to Marnie's point, that's another question of whether they continue or not. But it's certainly not a punitive kind of city imposed reason. And then there are surrenders. So sometimes a business will say, I don't want to renew my license, and instead of letting it expire, I'm surrendering it to the city. Or if there's a business turnover, so a bodega transfers to a yoga studio, that license will be surrendered. Punitive reasons are revocations. The city finds policy violations and revokes the license, or suspensions, again, due to policy violations. And I should say that most suspensions do not result in reinstatements. We've noticed that most suspensions end up, kind of dropping out over time. So here's what we found. Again, this is just in the borough of Manhattan, businesses that, or licenses that were completely lost. There were 254 in 2 years. And most of these stores were non-chain convenience stores, mostly bodegas. A smaller percentage were newsstands, grocery stores, smoke shops, and chain stores. When we look at reasons for license loss, we see that about 2/3 were non-punitive reasons. A lot of license expirations, just letting the license run out and not renewing it, but also a smaller number of surrenders. But about 1/3 of license loss was because of punitive reasons, most commonly being revocations. So we suspected that reasons for license loss would differ by store type, would differ by neighborhood characteristics. And we found that they did indeed differ by store type. So if you look at non-chain convenience stores, your bodegas and delis, your smoke shops, almost half of the time, these licenses were lost because of punitive city-imposed reasons. Whereas for grocery stores, newsstands, and even chain convenience stores, this was much less common. We did suspect that there would be differences in reasons for license loss by location. So we plotted on a map of Manhattan all of the stores that lost their license due to non-punitive reasons versus punitive reasons. It's hard to kind of see patterns from this map, but when you translate it into a heat map, you can see the patterns emerge a bit more clearly. So there was a higher concentration of non-punitive license loss in places like Midtown Manhattan and Financial District, whereas punitive license loss was more concentrated in areas of Northern Manhattan. There were also demographic patterns. So among stores that lost their license for punitive reasons, like revocations and suspensions, on average, these stores were located in neighborhoods with a lower percentage of white residents compared to stores that lost their license for non-punitive reasons. We found the reverse relationship for the percentage of Black residents. Stores losing their licenses for punitive reasons have a higher percentage or are located in neighborhoods with a higher percentage of Black residents. Same relationship for Hispanic and Latinx residents. The reverse relationship for percent Asian residents. So this is the same relationship as we saw for percent white. And then there was income was associated as well. So stores that lost their license for punitive reasons, like revocations, were more likely to be located in neighborhoods with lower household income levels. So in summary, this is to really conclude the season, we found that both of these policies resulted in a reduction in tobacco retailer density. So the pharmacy ban was more likely to benefit higher income, predominantly white neighborhoods, whereas this gradual capping policy appeared to have more equitable impacts. I wouldn't say that a pharmacy ban is a bad idea because it is more likely to benefit certain neighborhoods. Pharmacies should not be selling deadly products. But I think it's important, any city considering initiatives to decrease retailer density, do so in a way that is intentional in its equity efforts. So New York City, for example, probably suspected that this would be the case and supplemented the policy with a more gradual retailer reduction approach. And I said this before, I do think that a reduction in retailer density is a good thing. We know that it's strongly associated with tobacco use behaviors. We know that there's inequities in the retail environment in terms of people's exposure to promotions and industry marketing. So I think reducing that exposure will produce meaningful change. However, I think some of the mechanisms of this capping policy in particular do bring to light some of the challenges that certain communities face in terms of business turnover and over-policing and higher rates of policy violations. This was a small pilot study, so I'm hesitant to make any policy recommendations based on this Manhattan sample. But for the R01 that we submitted, we'll be looking at two other cities, the only two other cities that have implemented this type of policy, San Francisco and Philadelphia. So we'll have a much more comprehensive sense of how this license is achieving its impacts and whether they're indeed equitable. So future research, we should be monitoring unintended consequences. What is the effect of loss of tobacco licenses on economic equity and the local economy? And do we see an uptick in unlicensed sales? If demand for the products are still great, but the accessibility decreases, do we see more illicit sales popping up? And then finally, to Ron's point before, we don't actually know if this reduction in the retail environment exposure might impact tobacco use behaviors. We certainly suspect that it would based on economic theory, but we still have to measure that. That's it. So I'm happy to answer any questions. I'm gonna answer a Zoom question first. So this is from Melissa. How much does the rate of rent inflation for retailers, especially mom and pop retailers, drive sales of tobacco products? Are there any policy supports to help small businesses from tobacco sales losses? What pro-health high margin product can substitute tobacco products to help small businesses? These are great questions. So I think essentially, Melissa, what you're asking is, the loss of a tobacco license could have economic impacts on certain types of businesses. And are there measures in place to kind of support these businesses from not going under if the license is lost? New York City does not have any in place, but when I've given this talk before, that was a recommendation from the audience sometimes. Like, if the goal is to cut licenses and inevitably that results in some economic loss, could there be some type of supplemental program to transition retailers off of tobacco and to sell more health promoting products? We've seen that in nutrition initiatives, like healthy corner store initiatives, where the city or local groups work with retailers to help them sell more health promoting products, hopefully at a profit in a way that doesn't hurt their business. New York City doesn't have any kind of program like that, but I think it's something that other cities looking to implement a policy like this should implement. Ron.
I seem to recall that at some point in some stores, cigarettes, rather than being sold placed in a way that everyone could see, they were actually moved to other cabinets and with shading over. Mm-hmm. So you had to ask for it. It wasn't really there.
Right.
Am I making that up? Are there places that has laws that is the? And then the question is, did that have any impact on consumption?
Yeah, that's a great question. The question was, are there places where tobacco products are banned from being displayed at the point of sale? Outside of the US, definitely. Many countries, I don't know offhand, but many European countries, I know New Zealand is one of them, but all of their tobacco products are in enclosed cases. We have not done that in the US, and I don't know if we ever will because of First Amendment arguments. The tobacco industry uses that as their primary promotional tool. They invest most of their advertising dollars in advertisements at the point of sale. So I think if we attempted a policy move like that, we would face a lot of litigation from the industry, and it would probably be delayed for years and years and years. So to answer your question, it is effective. We know from these other places that it does reduce initiation among young people who aren't exposed to all that marketing, but we've not done it here. Gina?
Great presentation, thanks so much.
Thanks.
I wonder if there's any impact on media, for example, billboards, local newspapers, or whatever it is, given sort of these measures, have they actually increased?
Yeah. The question was, as the number of retailers decreases, if that's the tobacco industry's main advertising channel, have they supplemented their activities? Absolutely. So they've been leveraging more direct to consumer marketing. So tobacco consumers can sign up for text messages and emails where they'll be sent coupons and links about more information. So these come directly to consumers' homes now, directly to their phones. They have apps and websites. So we've definitely seen an uptick in those kinds of activities when the point of sale becomes more restricted. Yeah, Kathy.
Sure. Okay. I have two very different questions. One is, and this is just a thought process that might not be right. Like maybe it's because of drugstores, but like I can't get my toothpaste without calling someone to get it out of the locked thing. Anything like soap, lotion, toothpaste, anything. Yeah. So I just wonder, like, I'm thinking about what you're saying about the industry fighting back to doing that, but maybe there isn't a motivation by the sellers either. I just don't know how I think those things come into place in drugstores. They say because they're the most likely things to be stolen is what I've understood. Yeah. Half the drugstore. So that's one question.
Yeah. So the question was really about product access. We see in other types of stores that products like, shaving cream is locked and hard to access without asking for help. So do we see or why don't we see the same for tobacco retail? According to the books, retailers must ID anyone purchasing a tobacco product. They all have to be placed behind the counter. So there is that level of I don't know, there is that kind of gatekeeping measure. However, compliance is a whole separate issue. We're actually doing a study now with Columbia undergraduate students. The federal age to purchase tobacco products now is 21 years old, any kind of tobacco product. So we have a team of 20-year-old Columbia undergraduate students and we send them out into stores to try to buy cigarettes. It's important to note that in New York City, the buyer can't get penalized in any way. The onus is on the retailer not to sell, so they're not in any danger. But we visited at this point hundreds, maybe 400 tobacco retailers, and the purchase rate is about 80% for 20-year-olds who shouldn't be allowed to buy. So yeah, I say that to suggest that while there is on the books gatekeeping measures, compliance is pitifully low.
Another question is very different, which is like, are you communicating with, or is New York City evaluating this in their own way? Like, just wondering, like, how the people that made the policy are looking at what's happening.
The question was whether New York City is evaluating this policy. I imagine that they have plans to, but I know that during COVID, even people who were in the tobacco control branch were pulled away from that to deal with more COVID-related activities. So I know just from colleagues that I've talked to there that a lot of their evaluation efforts and enforcement efforts have been paused. Jennifer.
I'm thinking back to your first slide about the, which subpopulations have higher rates of tobacco use, and the people with anxiety disorders. And I'm just wondering if there are other, like, obviously there's smoking as a way to help manage that anxiety. I'm wondering if there are other more upstream policies that you've looked at as a way to reduce tobacco use among people with anxiety disorders.
Yeah, so the question was about people with anxiety disorders, and I'm sure any of the other subpopulations affected, but we know that they have higher rates of tobacco use. So what are some more upstream policy factors that we can kind of intervene on in order to achieve more equity? I've always thought, like, if you gave everyone basic universal income, make sure that everyone had access to everything they need, people probably wouldn't smoke as much, and we wouldn't see those inequities. So I agree with your point that drivers of tobacco use, it's not just marketing. It's a coping mechanism for many, it's therapeutic for many. But in fact, I know that a lot of the governmental policies targeting tobacco use have targeted much more downstream factors, like the cost of the products and exposure to marketing. I know that some behavioral interventions have tried to provide mental health supports to people who smoke, but it hasn't been this kind of large scale structural effort to target some of those upstream factors.
I'm just wondering that if you could look at any of the COVID relief interventions as a sort of natural experiment. I don't know if there are real-time data about tobacco use rates, but it seems like we've lived through a period where there have been anxiety-producing events and then some systematic attempts to push those.
That's a great point. And New York City, again, they're really good at making a lot of types of data available, and you can get smoking rates at the neighborhood level from New York City surveys and other sources, and you can map that onto things like COVID support services and other factors. So I think that's a really innovative way to look at how non-tobacco related policies may actually indirectly impact tobacco use. Thank you. Ron.
What's the age of alcohol consumption in New York State?
21.
Have you ever tried to compare, I mean, the data you gave about compliance with 20-year-olds buying cigarettes was pretty grim. Has anyone ever looked at the actualization of limits on consumption by age?
Yeah, so the question was about alcohol consumption. It's also that 21-year-old policy. Do we even know that has impacts on underage alcohol use? Anecdotally, I'd say no way. I mean, I'm sure we all know college-age students that get around that policy. I think with the Tobacco 21 law, at least I can talk about why they thought it would theoretically be a good idea. When the tobacco purchase age was 18, you may have had a 16-year-old with an 18-year-old friend. But it's less likely that a 16-year-old has a 22-year-old friend who'd be willing to purchase tobacco products for them. So the idea is that you would kind of widen that gap between peer groups that are purchasing for that person. You know, most tobacco use does start before the age of 18. So that was the intention. But again, like, yes, that makes sense theoretically, but it all comes down to compliance because the retailers are the ones that are providing this consumer product. I don't know if I answered your question, but I think compliance for both alcohol purchasing and tobacco purchasing are probably low, but I'd venture to say that tobacco non-compliance is higher. I don't know why, that's just a feeling that I have. Maybe because the age of alcohol purchasing has been 21 for so long, and maybe has been taken more seriously. I don't know. Azure.
Does the license get revoked if you sell to a minor?
The question was, does the license get revoked if you sell to a minor? After 3 strikes. So there's a fine, a pretty high fine actually if you're caught once, but you don't actually lose the license until the 3rd time. So it's possible that in these places that had revocations, there actually were policy violations happening. So it's not a bad thing if you're catching that. But again, you have to worry about the over-policing issue. Like, are people going in to check this more in certain types of neighborhoods? That's something I don't have access to. There's a question on Zoom, so I'm just gonna get to that first. This is from Christian. Are any trends on people purchasing or acquiring tobacco products via mail? Any policy in place to address this? Generally, you're not allowed to purchase tobacco products by mail. There are exceptions with certain types of like cigar products, but it's supposedly vetted. Like, you have to put your social security number in there and confirm your address, but I'm sure people can get around it. I don't think that that's a huge portion of tobacco product purchases though. I think most of it is happening in retailers. At least my sister's a middle school teacher and I get all my insight on youth substance use from her. But she actually just texted me yesterday. She was like, can you give a talk in my school? Because I caught 8 people vaping weed in the bathroom, middle schoolers too. So, you know, and my question for her was like, not like, yes, I will help these children. It was like, I need to know more, you know, where are they getting it from? She was like, I don't know, like no one's narked on them yet, but Gina.
With medical cannabis laws, actually, potential switches and maybe cigarettes.
Yeah, the question was about medical cannabis laws and just the increased liberalization of cannabis in general, and how might that impact tobacco use, if at all. We know that tobacco and nicotine co-use is very common. And we know that sometimes tobacco products are used as a vehicle to administer cannabis, like through blunts or vape pens. So we suspect that there is a relationship. And Morgan is actually leading an R01 to evaluate this. You know, not just what happens when a state legalizes marijuana and its impact on co-use behaviors, but how does the synergy between tobacco policies and marijuana policies impact that? You can't just look at a one policy, one outcome. You can't take that approach, you know, because many places like Seattle, Washington, for example, have pretty liberalized cannabis policies, but really strict tobacco control policies. So how does that differ compared to a place, can't think of an example, but that has liberalized cannabis policies and kind of weaker tobacco control policies? That intersection is really important and really understudied too. Merlin.
Great presentation, Danny. I learned a lot, and it was really cleanly presented too.
Thank you.
I have a couple questions if you have time. My first one is about the density question that Ron raised, and I'm curious to know if you think the city is barking up the right tree with the focus on concentration and density rather than just the absolute number of stores, because we know people move all over the place in New York City. They just have so much mobility. When I was listening to your talk and then respond to Ron, it kind of reminded me of like the moving to opportunity stuff, where there's kind of a mixed message on how important concentration is or isn't, and then, you know, the grocery store, the literature. And so I was just kind of wondering how you might explore that question more, and what do you think about this focus on density by the city The second question is to another like hypothetical, if the city asked you for your opinion, do you think the licensing ultimately, if whatever his name, what's the new guy's name? It's not Children, Bassan. And if he said, is this a success, Danny? Would you say yes or no? Because I actually have a kind of mixed reaction to the findings from number 2, because it seems like, yes, it doesn't have the racial inequity of the pharmacy ban, but it does seem like, to Melissa's point, that the small bodega stores got hit a lot harder punitive, and that does strike me as, you know, a disparity of some kind. And so maybe a little less comfortable, you know, that those kinds of stores, you know, seem to be singled out a little bit more. Even though they maybe should. But so what do you think of that?
Yeah, thank you. So there were kind of two questions. The first was about the city's focus on, you know, these localized density measures when people are very mobile. And the second was about, you know, is this second policy really equitable if clearly certain types of retailers, more independent retailers, are affected more in terms of their economy? So to answer the first question, the city is actually not focused on density, they're focused on the number of licenses. And I don't know if this will answer your question, but I have strong opinions about their kind of their decision-making for their target, for their goal. They wanted to halve the number of retailers in every district, but there were certain districts that at baseline had a much higher number and a much higher density. So even if these goals are achieved and everything's cut in half, there's still going to be inequities in the density of retailers. So I think an approach like Philadelphia's is more sound. Philadelphia, instead of saying we want to cut in half, they want one retailer per 1,000 residents across all districts. So kind of standardizing by density. And I think that's maybe a smarter approach. The second question about potential, you know, inequities in business outcomes from this capping policy. I agree with you. I feel that same discomfort. I don't really know what to make of it yet because we don't have any information from retailers about what happens when their tobacco license is lost. So keep in mind here that it's not like when the license is lost, the place goes out of business and drops out as a retailer. Most of them stay in business. The question is, how much of their business was affected by this tobacco license loss? And we really don't know that. You know, it might be 5%. There's a lot of studies suggesting that if you look at all consumer purchases from convenience stores, a small number are tobacco product purchases. So the loss of a tobacco license isn't necessarily end all be all, unless it's a tobacco retailer like a smoke shop, or that's their entire business. So I think, you know, before we can make claims about the effect on businesses, like we need to actually know what the effect on businesses is. So again, in our grant, we plan to do a lot of qualitative research with retailers who both have licenses and who have recently lost their licenses to kind of better understand this. Yeah, Melissa, one more question we have time for.
Maybe we just let her put it in.
Well, while we're waiting. Hi, Melissa.
Hi. I had a question above it. I thought it would be helpful if I said it rather than you scrolling up. Is that true, or do you want me to?
Yeah, if you can repeat it verbally, that would be great.
Yeah, so I was just wondering, going back to your initial slides about current users, particularly those with seemingly serious chronic mental illness, if we know any similar parallel studies about density in treatment programs or products, because it seems also a little bit unethical in a way that you have, population who is underserved with, addiction, and then you suddenly remove those products. And then, what do we know about the density of the counter to that of available programs locally for those populations?
Right. I don't have information about that, but I think that's important with any policy whose goal is to ban something or to reduce something. We need to make sure that's supplemented with something else that will make behavior change more likely and help promotion more likely. So I think about, things like banning menthol cigarettes or banning cigarettes, which some jurisdictions have done. well, there's people who are smoking there. So what, are there going to be any reduced harm products available to them if you take away the product that they not only use, but are potentially addicted to? So I think even with this, if you're reducing accessibility of products that people are addicted to potentially, are there more support services in these areas? I don't know the answer to that question, but I think that it's important that we need to make sure that that increase in services is available when we have any kind of restrictive policy. Thank you for your question.
Can I just ask one brief question? In one of your very early slides, you included the issue of e-cigarettes.
Mm-hmm.
And and I thought just now, as you talked about making available reduced harm products,
mm-hmm.
whether in your own analysis, you're treating the challenge of e-cigarettes in a way that is similar to tobacco.
Yeah, so I kind of glossed over it because of the time, but you saw in one of the slides that e-cigarette retailers didn't drop off at the same rate that tobacco retailers did. And I actually view that as a positive thing. We know that e-cigarettes are substantially less harmful than cigarettes. So I did kind of gloss over it because I don't view that as problematic. I don't view that as problematic as the tobacco issue. So it's kind of a good thing in my view if a lower risk product availability is kind of staying stable, whereas the most risky products are dropping off more. Thank you. And thank you everyone for your questions and time and attention. Appreciate it.
Thanks for putting up with all the craziness on the Zoom. Fantastic, Danny. And we'll be around for a few minutes, I think. The snacks to go are out back by the elevator. And just to remind everyone that we have the LitWack lecture two weeks from today. So see you then. All right, thank you.
Thank you. I'll stop this.
You know what I was thinking?